Thank you so much. Good evening, everyone. Thank you so much for taking time out of your crazy busy day. I'm certain that it was, and taking time to be with us this beautiful Tuesday afternoon. I am Dr. Joan Coker. I am an ear, nose, and throat, head and neck surgeon right here in Wilmington, Delaware. I attended medical school at the Medical College of Ohio, did my undergrad at Tuskegee, surgery internship at Howard University, and did my residency in Los Angeles, California at Martin Luther King Hospital. And I have been on the front lines of this crazy pandemic and all the havoc that it has wreaked. But we are here today because we have some real influencers among us that are willing to talk about their experience with the COVID vaccination. We will also take your questions, so feel free to put your questions in the Q&A box, and we will get to as many of them as we can. We are going to start this evening with a quick poll. So if you would take a moment to answer the question that will appear on the screen in just a few seconds here, then we will get started. When available to you, would you take the COVID-19 vaccine? Take a moment and answer this poll question, please. Right? Perfect. Thank you, everyone, for taking a moment to take the poll. Now, as we get started, we'll take a moment and we're going to meet our panelists for this evening. We're going to start with Ms. Bernice Edwards. Ms. Edwards, you want to tell us a little about yourself?
Yes, good afternoon. I'm Bernice Edwards. I'm Executive Director of First State Community Action Agency. We're a private, nonprofit, community-based organization serving residents throughout the state of Delaware. I've been with Community Action 40 years, and it has been a pleasure working with communities and families of low income, helping them to become self-sufficient.
Perfect. Thank you so much, and thanks for taking the time to join us. Now, Miss Renita Quayle, you are doing double duty. You are driving, but thank you for joining us, Miss Quayle. Can you unmute yourself and tell us a little about yourself? Can't hear you. Hold on. There you go.
Now?
Yes.
Okay. Hi. Well, I'm not driving now. I just got home. Oh, boy. Well, my name is Renita Quayle. I'm 55 years old. I have one daughter, 4 grandkids. I attend New Beginnings Community, AME Church, and Reverend Rita Page is my pastor.
Great.
And I am a missionary there and a missionary president. And I don't know, I'm a CNA. I do home health care. I work for Beata and Easter Seals as well. And I don't know. Any other questions?
Oh, we got some questions for you, but that's a great start. Thank you so much for letting us know who you are. All righty, Mr. Bill Colick.
Good evening. My name's Bill Colick, and I recently retired in 2018, but prior to that, spent 43 years in education settings in elementary through college. When I retired, I ran for the school board at Cape and Lopin. Currently a member of that, and been involved in our community. I've lived in this community, Lord's Rehoboth and Milton area all my life. And when I retired, we actually started a mentoring and tutoring program at elementary and junior high and high school. So currently working on that. Just recently been able to get back into schools because of COVID. So we're excited about finishing up.
Perfect. Thank you as well for joining us, and thank you for your service. Mr. David Williams.
Yes, good afternoon. My name is David Lamar Williams, Jr., and I'm the first vice president of the Central Delaware NAACP. With the assistance of Ms. Rita Page, I thank her for giving me the invite I've been a member with the NAACP for 2 years now. I had ran for governor for Delaware, and I got 18,296 votes, which was 15% of the vote. So that was something that I'm still achieving. My goal is one day to possibly become the governor of Delaware. So this is a great opportunity to discuss and tell people about the getting the vaccination, how important it is. I'm married. Been married for 8 years to my wife, Angela Tina Johnson Williams. She is also a member of the NAACP chapter here in Central Delaware. She's on the political action team, and it's just an honor to be to get this opportunity to talk and let the people know how important it is to get the vaccine.
Perfect. Thank you so much, and thank you for your service. All right, so tonight, sponsorship. We want to thank them for believing in us and putting their money where their mouth is. So let's start with our sponsorship list. Trinity Health Mid-Atlantic St. Francis Healthcare, Modern Maturity Center Incorporated, the Interdenominational Ministerial Alliance, the Community Intervention Team, the National Coalition of 100 Black Women, First State Community Action Agency, Wilmington Community Advisory Council, the Delaware Racial Justice Collaborative, and United Way of Delaware. And also, I think I have one more, looks like H&S Impact GP. And thank everyone for believing in us and trusting in us and sponsoring us for this great night. So now we're going to start a little round robin. As you load up your questions in the Q&A box, we're going to talk with our panelists. Miss Bernice, why on earth did you get the COVID vaccine?
Doc, I got the COVID vaccine for 2 reasons, not 2 reasons, many reasons. As we look at what's going on and all that has been going on, I just felt that science and hearing you, because you were an inspiration to me, that I heard you and you talk about it. But it gives us opportunity, and families, especially the grandparents, being able to see their kids, their grandkids, but also it's just the science that we had to believe, because there was so much of the myth that we should have taken it, and as I said before, listening to some of the workshops that I had attended that you had talked about, and the trust, and I trust the science, and that was one of the reasons that I took it. I prayed about it first. Prayed about it first, and I took the vaccine, and then after the second shot, I was able to, in the 14 days, and now I can go out and I can tell people that, take the shot, but listen to the science.
That's right.
Make sure that you understand, because we are not going to start to put something on you that you're not comfortable with.
That's right.
And people would do that if they believe in the people that's telling them that.
Yes, we have found out in more ways than one that the messenger is critical.
And
Mr. Collett,
people.
Oh yeah, Mr. Collett, how about yourself? Why would you consider getting the vaccine, and why did you get it?
Well, I'm going to tell you why. My wife is a respiratory therapist, and actually in the emergency room at a local hospital, and so she's front and center and was with this virus. And so as soon as it became available at her workplace, she got it. Prior to that and during that time, I was unable to get it initially. And so I was getting tested every week. I ended up being able to get it as a result of First State Community Action. And I attempted I went to my primary. I actually, I got in line at the Georgetown motor vehicle and to be told that you have to have certain things. And then the next week, I saw a bunch of people getting it, walking in, riding up to Dover and getting it done with not having to have certain things. So I'm very blessed to have been able to get it. As Bernice Edwards said to you earlier on, my wife and I prayed about it because initially when they hadn't got the virus, hadn't got it at that hospital, and so we prayed about it and things worked out. And I certainly will tell anybody it is the way to go. I also, one Saturday morning, there was a piece on CBS about two individuals that had worked very close with this vaccine, and I saw that and I felt very comfortable with that and who they were and getting it done, and that's why I got it.
Perfect. And we are so appreciative that you got it. And we thank your wife for her service as a frontline worker, as a respiratory therapist. She has seen it all. And
Yes.
That is the weapon that we have right now. That is the weapon in the toolbox. Certainly prayer changes things, but God also gave us the wisdom to know when something has come forth that would be beneficial and we can take advantage of that. Mr. Williams, how about yourself? What made you get the COVID vaccine?
I had got it in November of 2020, and I infected
You
everybody.
got COVID in November of 2020.
Yes, and I infected
Gotcha.
everybody in my family. My wife got it, my mother-in-law got it, and my father got it. And when I got it, I was still kind of a shock, so I didn't think I could get it because, listening to TV, and I thought I was very healthy. And what happened was my wife wound up in the hospital. My mother-in-law wound up in the hospital. My father wound up in the hospital. They was in the hospital for a week. My wife was actually, it was really bad. She had it really, really bad. They had put her in the ICU. My mother-in-law, she actually was on a ventilator for 2 days. That was very scary because, when people get on the ventilator, you don't know. Most people, I never heard anybody that got off the ventilator. So what happened was she did get off, but the whole time I was home by myself, and I was experiencing pain and discomfort, shortness of breath, couldn't even get out of bed a couple of days. So it became available, and I was in the range. I'm 54, so when the governor made the requirements that you had to be 50 and plus, I had called Rita Page. I called Rita Page on Monday. I got the shot on Saturday, all three of us at the Bay Health there in Dover. So I was very thankful because we watched the news and we saw like what Mr. Colick was saying.
Yeah.
People was having a difficult time getting the shot. I got it in less than 4 days. So I'm thankful that we got it. We had a little bit of discomfort. My wife has a big bump on her arm, but that's going away. My mother-in-law, we all had that discomfort in our arm from the shot. But we was very thankful that Rita helped us get it. And like everybody, I prayed too. And I thank God because he kept us, during this time, because you can see it's over 500, and it's getting close to 550,000 deaths. And thank God we're still here, that we can even talk about it. So it's, to me, it's very important to get the shot.
Yes, you're absolutely right. And Ms. Renita, I know you're moving about. I was trying to get you at a steady spot because I know that you are just getting home from work, and we certainly appreciate you joining us. What made you get the COVID vaccine? On mute, my darling.
Unmute. Okay.
Yeah.
Okay. Well, really, I didn't want to get the vaccine, but I know I need it because I did have COVID. My daughter and one of my granddaughters and my co-workers, and I work in home health care. So I know I needed to get it, but I was just putting it off as long as possible because I really don't like the idea of getting shots and all of that. But I just got mine last week. Well, this past Saturday.
Mm-hmm.
So, and I was not doing very well with it, but I'm doing better now. I was like, oh no, it feels just like me getting sick all over again. But I'm feeling better now. So, and my energy's coming back. But I know I needed it because I work in healthcare anyway, and trying to make sure that I don't infect anybody else, or that I can't catch it from anybody as well. So
Perfect.
I just did what I had to do.
That's right. So let's talk a little bit about the COVID vaccine between some of these questions. So let's just start with the bottom line is there is no COVID in the COVID vaccinations. There is no viral portion, not a part of the virus, not a little bit of the virus. There is no virus in there. So everybody that has looked at the television and you've seen something called the COVID molecule, it's got all these little red antennas on it. And those red antennas are called the spike protein. So the vaccines are geared toward that spike protein, which is on the surface of the COVID vaccine or the COVID molecule. Because what COVID does is it gets into your system, uses those spikes to bury into your cells, normal cells, and then virus gets transmitted into your cells. And so it's a very efficient virus. And many of you may have watched the CNN special on Sunday. And there was a revelation in that where Dr. Redfield, who was the CDC chair while all of this was going on, said, this may have been a lab accident. And he says that because he's been studying virology for over 30 years. And when it goes from a bat to a human, it's usually not that smart out the gate. But the idea that this virus responds differently in every single human being, he believes, just like everybody else that has COVID in their arsenal, trying to figure out a vaccine for it, they may have created something that was a little scary, a little smart, to be honest with you. In fact, it's very smart. That's why it continues to create variants, even as we're in the process of creating vaccines. New variants are coming out every single day. Thus, some of the numbers are going in a different direction. The good news is the COVID vaccine seems to be helpful with the variants. But I am going to encourage everybody, just as my colleague panelists, if you have the opportunity, when, because now, as of today, Delaware Online just announced 16 and up, you are eligible to get in line for the vaccine. And my goal for every single person in the state of Delaware is if and when you have the opportunity, please get in line and get vaccinated. It is the only weapon that we have right now. Like I said, I know prayer changes things, but there is work with prayer. And the work is I've got to take advantage of that which I had. Now let's talk about the J&J virus, because the J&J vaccine, because a lot of people are like, I'm waiting on the Johnson & Johnson. I don't like needles. I just want one shot. Johnson & Johnson is a good vaccine. It may not be as efficacious, meaning it doesn't work as well, like Moderna and Pfizer. Once you've had the second shot, 2 weeks later, you have a 95% chance that if you get COVID still, the likelihood that you'll need to go to the hospital, that you'll need a ventilator, in other words, that you'll die, is far less. There's a 5% chance that you still might, but there's a 95% chance you're going to make it. And that's all everybody wants to know. If I get it, am I going to live? And that's what you needed to know. Now, with the J&J, it looks like it's maybe about 75 to 80% efficacious. Now, it will keep you from needing a ventilator and being in the hospital. Now, unlike the Moderna and the Pfizer, it's wrapped in something called the adenovirus. The adenovirus is not COVID. Adenovirus is the common cold virus. A lot of us get it every single year. Big deal, no, but you need to know that instead of a lipid molecule getting it into your body, which is a little fat molecule, they wrap their vaccine in adenovirus. The other thing is there's something in it called polysorbate, which is just a preservative, but a lot of people that have allergies to vaccinations are allergic to something called the polysorbate. So if you've ever had a reaction to a vaccine, the J&J vaccine is probably not the one that you want, okay? If you have allergies, don't panic. Allergies to tomatoes. Oh my God, I'm allergic to mold. Oh, I'm allergic to grass and trees and this and shellfish. You're fine. Any vaccine is fine. If you've had a reaction with a vaccination, and I know this because a teacher just called me and said, hey, I went to Africa one year and I had an adverse reaction to malaria. So I Googled the contents of a malaria vaccine. I coupled that with what's in Moderna, what's in Pfizer, and what's in J&J. And the only one that has that polysorbate is the J&J vaccine. So we brought her in, we gave her the Pfizer vaccine, we watched her for 30 minutes, she did amazing. I called her the next day, she was fine. So it just depends on where you are. We've got to do some research, but as physicians, we are here to help you answer these kinds of questions. Somebody just put in the chat and said, listen, I'm 30 and under are not interested in this because they think it may decrease the likelihood of them being reproductive. That is not what the Academy of Obstetrics and Gynecology says. As a matter of fact, when they were running the vaccine trials, many women got pregnant, had babies, and the babies are fine, and they did fine. And many of you see on the news, hey, there's a lot of people that are pregnant that are getting vaccinated, so don't panic. That is not the rule. Here's what happened that stirred all of this controversy. They gave it to a sheep. The sheep wasn't able to be reproductive, but that is an animal model. That is not a human model. So that's where it has all started from. Do not panic. People got pregnant in the trials, had their children. The children are fine and the mothers are fine. Therefore, the Academy of Obstetrics and Gynecology fully supports every single vaccine that is on the market for every mother, be you pregnant, trying to get pregnant, having just had a baby, and you're breastfeeding. You're absolutely fine. Okay? Now, let's go back to our panel, if you will. So, Ms. Edwards, tell us about any side effects that you had and how you managed. Was it first shot, second shot? How'd you do?
I often tell anyone that I'm talking to about the vaccine, the first shot, I had the Moderna. The first shot, I was fine.
Mm-hmm.
A little sore. The second shot wasn't so okay. And that's what I tell people. If you're honest with people,
yes,
tell people the truth, then there's no reason for someone to say it didn't happen. My second shot, I got it like 3:30 on a Tuesday.
Mm-hmm.
I did really well because I drank some orange juice and ate a small donut.
Okay.
I had taken it. I guess about 10:30 that night, I started to feel a little woozy, and I'm like, wait, whoa, what's going on?
Mm-hmm.
I slept all day Wednesday, and I'm thinking, oh my goodness. However, I probably was tired anyway, and I needed to sleep. So I slept all day Wednesday. I got up Thursday. I was fine. I came back to work, and I've been working ever since. You will, some people, it doesn't even affect. Some people, it affects different ways.
Mm-hmm.
To say that both of the shots, you don't get any side effects, you can't say that to everybody. But I know what I experienced. And I'm telling you, I feel fine. And I continually wear my mask out when I'm out. And, I wear my mask. But I tell you what, I feel very good. Very good.
Perfect.
Very good.
Perfect. Yeah, the interesting thing about the second shot is your body has already been exposed with the first, and so it kind of gets revved up. So when you get your second, it's an even more robust response. And like you said, it lasts about 24 to 48 hours. You have everything from a headache to extreme fatigue, which means I'm so tired, can't even get my head off the pillow, just like you said. But the studies have shown if you drink plenty of water and sort of time things. So talk to your boss, talk to the school, talk to your family to say, I can't plan a lot day 2 after the second shot because I'm not certain exactly how I'm going to feel. But I will tell you this, the more of a response you have, the more you know that the vaccine is working in your system. So it's actually a very, very good sign to all of those that have had a reaction. Me, I just had a sore arm. So I was kind of down in the dumps that I didn't have a more robust response, to be honest with you, because I wanted to feel tired just like you did. I wanted the chills. I wanted the whole 9 yards, Renita. And I know you said you had some symptoms. Did yours last more than 48 hours, Ms. Quayle?
No, I just had it done this Saturday.
Okay.
And get out of there, dog eating cat food. And and I'm feeling fine today. I was not feeling as good yesterday, but I'm feeling better today. So
Great.
It didn't last long. And like one of the clients that I take care of, because we got it done together, she said, well, it beats the way we felt when we both had COVID, because we were feeling it. We laid in the bed, or I did most of the time, like for weeks with the same symptoms, but worse. And hers was bad also, but mine, I came around slower than her. But anyway, it said, if we can be sick like that for one day, instead of having it for the length of time and study getting worse. So she said, well, it's worth it. Because I said, next time I'm not getting no more shots, because I got one more to get. And I was like, I don't know if I'm gonna be sick like this. But they said, if I'm sick this time, maybe the next time it won't be so bad for me, because my daughter had it and she was sick. I vomited. I was headache, sleepy. I just laid in the bed the whole day. I couldn't even get up until like 6 in the evening to get up. Well, I got up to eat a half a banana, take Tylenol, and went back to sleep.
Yeah.
And I tried to eat later, maybe get some soup and feed the animals and back to bed. So
Yeah.
it's like, man, I said, I don't know. This ain't working for me. They shot me up with more COVID. That's what somebody told me. I was like, oh, terrific.
No, ma'am.
I know.
No COVID.
But that's what I felt like. I said, they
I
ain't
know
shoot
it.
me with nothing else. No more.
No.
I'm done. But I'll go ahead and get the other one and
Perfect.
go from there.
I'm glad it's going to be a weekend shot for you. Now, I see
Yeah,
one
it
more
has
or
to
a couple
be.
more questions in the chat. One is, if I'm on an antibiotic, can I still get the COVID shot? Well, it just depends on what you're on an antibiotic for. If you're on an antibiotic for an upper respiratory infection, like a sinus infection or sore throat, tonsillitis, no, we don't recommend until you finish that antibiotic and for another week. Then you can get it 1 week after you finish for an upper respiratory infection. If you're on an antibiotic because you had a sore on your leg or you got a urinary tract infection, you can still get it. But anything that may cause an upper respiratory infection, so that it's hard to determine whether it's the vaccine symptoms or whether it's the upper respiratory tract infection that you had. And the last thing we would want to do is exacerbate that infection that you're currently dealing with. So if it's an upper respiratory infection, you've got a hold. A lot of folks are on immunotherapy, either because they have an autoimmune disorder or, God forbid, you have cancer and you're undergoing chemotherapy. You're one of the ones that we are fighting to get you in line and get you taken care of. And our prayer is that you will respond when you get the COVID vaccine. And if you have one symptom, I want you to do a little hallelujah praise, because that means your immune system revved up and responded to the vaccine. All righty. So if you're on suppressive therapy, you're the most vulnerable. So yes, we are totally advocating for you to get in line. Someone else said, I've tried Christiana Care. I've tried several other physician offices. No physician seemed to be doing it. Our office is. We're getting ready to get taken over by the counties in our space. So they're going to be doing it every single day in our office. So get a message to me and we're going to work to get you squared away, because we are one physician's office that definitely is getting it. But I guarantee you, many more primary care doctors are getting ready to get into this vaccine situation, especially now that we've taken it all the way down to the age of 16. It's an all hands on deck situation. So be a little patient, but send me a note, get a note to me, let them know you just saw me in a webinar. I will respond to you and we'll see what we can do about getting you squared away. Mr. Collick, did you have a lot of symptoms? How did you do with your shot?
I did not. My arm was just a little sore. 2 shots of Pfizer. My wife as well had a sore arm, but no symptoms at all. Now, It's amazing because my son and his wife are 35
Mhm.
and they had some symptoms.
Yep.
But I have a niece that's in her 40s. She did not have any symptoms, and my daughter in her 40s did not have any symptoms. So that's kind of where we were family-wise.
Yeah. And the younger you are, the more robust your immune system. And so you can almost be guaranteed that you'll probably have a little something. So young folks, when I say young folks, I'm gonna say 16 to 40, the likelihood that you'll have symptoms, especially after the second shot, is pretty high. That 40 to 50 is the gray area. Most of us over 50, we can make it. And if we have a little something, what we know is that these side effects in no way compare to the side effects of COVID. COVID, those side effects we know. We've got folks that now have lupus. We've got folks that are out of gas, memory shot, can't catch their breath, lost a limb. So we may not know all the side effects of these doggone vaccinations. You're absolutely 100% accurate with that. But what we know is that we've got some long haulers. I saw a young lady today who's not even 20, who can't taste and can't smell. And the smell that's come back, the sense of smell, smells like garbage. So she's lost 100 pounds since December because she can't eat because it makes her sick because she had COVID right before Christmas. And now that her sense of smell is coming back, it's very distorted and it makes her nauseated and she vomits every time she eats. So when I tell you that 48 hours of side effects is nothing, and David, you'll tell me this because you've been through COVID, but let me know if you agree. Those side effects of the vaccine have no comparison to what people are going through that have had COVID. Would you agree with that?
Yes, doctor. You know what was funny? When I just got this first shot on March 20th on Saturday, and I had sore in my arm. It was very tender. So when I took a shower, I could feel the pain. But you're right. When I got it, you know what happened? I didn't even know I had it. And what happened is one of my friends said, "Dave, can you smell and taste?" And I didn't even think about it because I was eating because I had to eat. And what I did was I sprayed some Febreze and I couldn't smell it. And then what I did was I got I ate some Captain Crunch and I couldn't taste it. And then I realized, wow. But it came back gradually. I felt like I was a long hauler too because I was constantly tired. I had pain all in my legs, pain in my back. The one day that I had COVID real bad, I couldn't get out of bed. It was unexplainable. It was on a Wednesday and I was trying to get out of bed and my legs couldn't move. And I was trying so hard to get out of bed and it was impossible. I actually had to crawl to the bathroom. So I called a friend. He said, "Dave, you need to go to the hospital." But I prayed to God. And the Thursday morning I woke up, it was gone. But at that time, my wife, my mother-in-law, and my father was all in the hospital. So I was home by myself. And then I saw the news later, like maybe a week later, and I saw that people were dying in their house by themselves. So I was like thankful to God that I survived. That Friday was one of the worst days. I woke up sweating. I couldn't control it. I was profusely sweating, like water dripping off. There was pain in my stomach. I was throwing up, and I was like, "This is crazy." And so I knew when the shot was going to come out, I was getting it. I couldn't care less. And what happened was my wife, she actually got it twice. That was unheard of. She had got it once in November, and then she got it again in January, both times going to the hospital. And when she got it the second time, we didn't even believe it. How could you get it twice? We thought you could only get it once. You know what the doctor told me? Stop watching TV. He said you could get it multiple times. We just thankful that, you know, everybody survived the COVID and that we all took the shot. So it's very important to take that shot. And I'm 54. So I'm a champion of it. And like I said, I thank Rita Page for getting me the shot within 4 days. I mean, like I hear these horror stories and I'm like, I thank God I got it in 4 days. And what I'm finding out is a lot of African Americans, we're the main ones that don't want to take the shot. And we're the ones dying the most. It makes no sense. We need to be in that line to get that shot.
Yeah. You just brought up some really great points in your explanation. So one, please understand that once you've had COVID, it looks like on an average of 90 days, you may have antibodies to COVID, which will help you. If you've had COVID, can you still get the vaccine? 100%. And we were thinking initially we were going to wait 30 days after your first negative test. But now anybody who tests negative, once they've had it, we're vaccinating them right away. You come in the office, you've had COVID, we're going to vaccinate you. We know you may have a 90-day supply, but we're going to vaccinate you because we know those antibodies are disappearing very, very quickly. And the antibodies from the vaccination seem at this point, I saw one question, how long do they last? So it looks like right now, the studies only show 6 months, but that's because that's how long the study ran before they released the vaccines. So the hope is that we'll get more than 6 months, but those of us that got it early, we'll probably start, especially all the physicians and those in healthcare, that we can go ahead and get an antibody test to see if we still have antibodies. And if we're out by, let's just say September, that's about 6 months later, then we may need a booster shot. So everybody needs to strap in. Are you going to need a booster? Yep, you're going to need a booster. You're going to need a booster for probably the next 3 years based on all these variants that have popped up. Pfizer versus Moderna, which one is worse? We're finding that Moderna seems to have a few more side effects in younger people than the Pfizer vaccine. But I can tell you, folks are getting Pfizer and having problems with the second shot. Folks are getting Moderna and having problems with the second shot. Folks are having problems with the first J&J shot. For sure, they're having some reactions to that. Nothing lasts forever. It's on average about 48 hours and you will be just fine. The other one said, I've had somebody's getting a kidney transplant or heart transplant, a lung transplant. That's an immunosuppressed person because you've been on steroids for a while so that you won't reject that new organ. Of course you need it. I wish I had Dr. Scantleberry with me today, who was one of the first, or is the first African-American transplant surgeon that I've been doing most of my webinars with. And she is advocating hook, line, and sinker. Anybody who has a transplant, you absolutely need to get the COVID vaccine. Are there any medications that mix negatively with the COVID vaccine? Not to our knowledge. There is nothing that we have to say, oh, if you're taking this, you need to hold this. Now, what we are doing with our folks with allergy shots, if you're getting allergy shots, we're waiting 48 hours between your allergy shot and your COVID vaccine. So I would recommend if you're on allergy shots, you're going to be somewhere where you're not going to get a COVID vaccine for another 48 hours. Let me see, did I cover everything? Negative medications, Moderna. How long do they last? And like I said, right now, it looks like we've got 6 months of immunity, but certainly it may be far longer than that is what we are hopeful for. Now, Ms. Edwards, if someone is hesitant, what are you saying to them directly? Like let me talk to you for just a minute as to why. I understand your hesitancy, but this is what I would say to the hesitant person as far as the vaccine is concerned.
What I would say to someone who is a little hesitant, on the fence, is to tell them my experience and reassure them, because what I've seen is, I know as people come into First State, and I've had people say to me when they come in the door, you know, I was a little bit hesitant, but I see you sitting here, Bernice. You took the shot, and I believe you. I believe that I will take the shot. But I think what is so important is to make sure that we are being truthful, we're being honest with people, we are telling people, and I often say to them, you know, I know you're watching TV. I know there's a whole lot of people out there is saying it's a hoax and it's this or it's that. I would say to them, I took it because I believe in the science and I believe in the doctor. When the doctor talked, you know, will explain to you. And I think sometimes the explanation people don't really, it doesn't really sink in. But as I was telling you earlier, when we got on, I had a lady who said to me, I'm not going to take, you know, don't say that. And it's a myth among African Americans anyway, that, you know, don't take it, you know, is this or is that? And I'm like, listen, this is a myth. This is the truth. Listen to the truth take the vaccine and be honest with, and I often say, be honest with people. Yes, it's not going to be, you take it and nothing going to happen. You're going to get some side effects.
Yes.
With people, I think people will, and we've had people say, okay, lady came in today and she said, you know what? I thought about what you said to me. She said, I'm here today. She was on her cane, but she was here.
Mm.
Took a shot today because we had a clinic today.
That is great. I appreciate your honesty. And I think that's what we're all finding, that courageous, perfect conversation, because we know the history in this country and why the hesitancy among African Americans, because we have been experimenting on from everything, with everything. And it wasn't just an isolation of a doctor's office doing it or some random person. No, it was Department of Public Health that ran some of this experimentation. So we have every reason. But the good news is the National Medical Organization of all Black physicians, they were at the table from the beginning. And they were invited to the table, which is more impressive. And we have a coalition and we meet and they keep us informed. We talked with Dr. Kizzmekia Corbett. She answered all of our questions, who's one of the leading African-American scientists with Moderna, and her boss, who's been studying for 40 years. He was so moved by one of our conversations that we were having, that he said, I've never told anyone this, but most people that know me know this. It was like, my wife is African-American. He was like, I have African-American children and I have African-American grandchildren. And that's why Moderna paused their study after a while and recruited more African-Americans to make sure they got it right with us, because our systems function differently. We respond differently, and they wanted to make sure that they got it right. And that's why they were lagging a little behind Pfizer, because they paused, recruited more of us to that study. And we really appreciated his honesty, because he didn't have to say that. And Kizzmekia had the hugest smile on her face, because they were in two different places, but she couldn't believe he said it. But he was moved to say it because we were having just an honest dialogue. I'm talking about thousands of physicians from all across the globe that were putting questions in the chat. And we were talking to all of the leaders on the front line, including the guy who came up with, who called it Operation Warp Speed? Who does that? But it was a Star Trek fan. But it is disconcerting to think that something comes out at warped speed. So it was not a great idea to name it that, but they did. And they were apologetic for it afterwards, but they just thought he was a Star Trek fan and he thought it would be a great idea. And that's where we are with some of the stuff that we go through in life. Now, someone asked a question about mammograms. That's a great question, because that's one of the controversies that we're having right now, because a lot of women and men are getting lymph nodes that are enlarged. Some have come in and I've seen them in the neck. Some of them are occurring in the armpit. And so those that are scheduled for mammograms, now they're saying perhaps you should wait about a month between mammography and vaccination. But the best thing to do is talk with your gynecologist, because they're the ones that are getting this information firsthand to tell you exactly what the newest guidance is. Because if you look in their Mayo Clinic and saying, still do it, we see the lymphadenopathy, we'll note that you just had a COVID vaccine and we're not worried about it. We don't have to biopsy everybody. But some are saying, let's put some distance between vaccination and mammography. So what I would say to that question is, please talk with your gynecologist, because they're getting firsthand information daily from their academy as to what the protocol should be. Now, somebody said, how safe is it to socialize with other people who have also been vaccinated? It's great. We all feel good, those of us that have been vaccinated, but you still got to wear your mask, my dear. You still got to social distance, but there is a sense of relief with those of us, because our contagious level is far lower. So if the mask slips down, or if we're having a conversation in the office, or you're standing a good little distance away from one another, the likelihood that you'll transmit that virus one to another, if you have it, is far, far less. That's the good news about vaccination, is the transmission from person to person falls off precipitously. That's what's great about that. I'm experiencing a stiff neck from the Pfizer shot. Hang in there. This will get better. I promise you, this will not last forever. What is it that a booster shot does? That means that both shots 1 and 2 again in 6 months? No, not necessarily so. What the booster shot will probably be will be to a lot of these variants, especially some of the more aggressive ones. The good news is the genealogy, meaning the makeup of the virus, doesn't seem to have changed. The spike protein seems to be changing, which is awesome. And it makes it easier for them to create a newer vaccine that includes some of those variants. So when I talk about a booster, do I mean that you need shot 1 and shot 2 again? My hope is no, but I'll tell you, if it's shot 1 and shot 2 again, I'm going to do it. I'm going to do whatever I need to do to keep practicing medicine the way that I am, where I'm not fearing that my patients in my quest to keep them well are not going to kill me and my family inadvertently. So it's the weapon that tells me, Joan, you just may live. And that's all I needed to know to get right back on the battlefield. I stayed on the battlefield regardless, because every patient we have has a sore throat, change of taste and smell, dizziness, shortness of breath, cough. That's who we are in ENT. So we couldn't stop. We still had to go to the hospital, still had to scope patients with limited PPE equipment. But I used to undress in my garage thinking that I was going to come in and take my whole family out. I didn't hug my mother for a year nearly until we both were vaccinated. So let's just get back to living is what we're saying. Let's get back to some sense of normalcy. And what we should be afraid of as African Americans, if they weren't offering at all to us, that's when you worry. That's when you're concerned. Not that we, aren't fighting to get you a front seat in line. And we are working to get more vaccination sites up now that we have all of the product that we need. It has been limited in Delaware, but now we have a huge supply, thanks to our president and vice president. It is in huge supply. We're going to ramp up and we're going to meet these needs of everybody who wishes to have a vaccine getting the vaccine. All righty. Now, Mr. Collins, what would you say to someone that's hesitant?
Well, I've had some experiences with I coached college football, and I had a young man that played for us in the early 90s. He went home, got his doctorate degree, became a principal of a high school at 49, passed away. Oh. I was good friends with a guy that lives in this area, and I'm 69. He was a grade behind us. We were seniors. He was a junior. I was better friends with his friend. He passed away last year. So I'm saying to you, when I look at it, it doesn't make sense not to take the vaccine. On the other side of that, the alternative, I just don't think is very good. I also thought, just logically, when this thing first started and they were giving all the healthcare people the vaccine. So the very people that we are hopeful and expect to take care of us, are we going to get them sick as well? I just don't think so. I mean, why would we then, if it's not been tested and whatever, why would we give Dr. Coker not give you a vaccine or give you a vaccine to get sick? Then how would you be able to take care of us? And I just use that logic as well. So I'm a simple guy.
Wow, that's a great point. I never thought of it like that, but that is a great point, because Lord knows if they had taken out the entire workforce who got it first, oh my goodness, we would have all been in quite a trick bag. But you bring up a good point. So even if you don't think you need it for yourself, because I eat healthy, oh my gosh, Joan, I'm a herbalist, I take my vitamins, I do these supplements, I get it. Even if you don't think you need it, do it for someone else in your life. Do it for a family member. Do it for the young and the old, because everybody thinks these young people are fine and they're just going to get a little something and make it through. People have lost children, young people who are healthy. There was a football player, I think it was at the University of Pittsburgh. First day of practice, his roommate had it, he's gone. He's 19. And mom said he'd never been sick a day in his life. He's gone. So don't think. So even if you don't want to do it for you, do it for someone else in your family.
Right.
Because that's what it's all about. That's what all of this is about. That's what the mask wearing is all about. It's not about you. It's about us. It is about the collective caring community. Grandma, papa, auntie, everybody. We know who's important to us. So even if you don't need it, don't take them out just because you're healthy enough to manage it. Because they may not be. You cough, you sneeze, it's a wrap. They may be gone. And there was something that you could do to be less contagious when you sneeze, when you cough, when you spoke without a mask. That's a big, big deal because no one wants to take anybody out inadvertently, but it's been happening to the tune of over 500,000 people. All right. Now, Juanita, what are you telling people that are hesitant? What would you say?
Me.
You were unmuted. There you go.
Oh, I was already unmuted.
Yeah.
Okay. Can you? Oh.
Yeah, we can hear you.
Well, I personally, I had no people that are telling me that they're not going to get the shot. And they don't know why I got the shot because, you're letting them shoot this drugs inside of you. You don't know what's going to do to you and all this stuff. So I'm just trying to wait for my second shot. And then they're watching me to see how I'm reacting to it. So they say, oh, how you feel? Oh, this and that, because I was feeling bad. They say, see, I told you. That was my mom, my friends, they're watching. So I'm going to let them see how things go with me and say, see, it wasn't that bad. Yeah, I was sick for one day, but I'm doing better now. I'm back to normal and everything. So they're watching to see what's going to happen to me. Because at first I was watching to see what's happened to other people. I said, I'm not getting that shot. I'm seeing who died off first, not me.
Right. Yes, ma'am.
That's how I was thinking, but I knew I needed to get it. But anyway, thanks to my pastor, I got signed up to get it because I was waiting for the Johnson & Johnson's, figuring I could just get one shot and maybe that would be okay. But anyway, I got Moderna and I'm glad I'm doing better now because I was down. And I'm trying to see how, I think I'll be good the next time.
Yes.
Because I'm copying up how my daughter, because she had hers first. She works at Delaware Hospice. She had hers first. She had a fever and all that. And the next day she was fine too. She said, see, you're going to be just like me. I had that problem and then I'm better. So if I can tell other people, yeah, you may be sick for a day, but it's going to be worth it in the long run if you go ahead and get it and you're protected, protect yourself and protect other people. So they're all watching. I got people watching, trying to see how I'm going to do with this shot. So I got to let them know, hey, I'm back to normal. I'm working and I'm cooking because I wasn't even cooking that day. I ain't cooking nothing. I ain't getting out of bed. I don't even want to shower. But I'm going to let them know that they need to get it anyway.
You are awesome. You are awesome. Well, we're going to be respectful of everybody's time. And we are just about at the end of our timeline. But Dave Williams, you were running for governor and it's not over for you. You got one more in you or two. So let me ask you this, soon to be governor. Someone just said, what if someone refuses to get the vaccine because of political beliefs? So how do you manage that conversation, Governor?
I mean, the thing about it, ultimately, we're going to make our own choices. I mean, we can't make nobody take the shot. It's up to the person. I just can only share my experience, what happened with my family, and how the scariest part was when my mother-in-law was on a ventilator. That was a scary thing because she was on there for 2 days and we feared the worst, but God brought her through and she survived. So to me, that's an awesome testimony that she survived because she had underlying conditions all that stuff that they said on TV. She got dementia, she got sugar diabetes, all those things was running through, and the family was afraid as well. But she pulled through,
I love
and
it.
her breathing was slow. So for me, I know it's important. For the political reasons, I think the governor of Delaware, and I think you can Google it, he's got in the books where he can force you to take the shot. Now he hasn't implemented it yet, but I mean, I think what's going to actually eventually happen is for the people that don't take the shot, I think they're going to say, well, you can't do this and you can't do that. You might not even be able to go back to work. You might not be able to come in here, because we got to try to get back to some normalcy. I mean, they're talking about what, 80%? They want the people to be vaccinated so we can at least take off these masks. Because I think a lot of people are tired of wearing these masks. I am, you know what I mean? So for me to take the shot and maybe one day not wear the mask, walk into Walmart mask free, I'm praying for that day, because it was beautiful when we didn't have no mask. But sometimes you wear the mask, you be like, why am I wearing this mask? I just got my shot. But the other people out there, they fighting it, don't want to get a shot. And like I said, the scary part, like you said, you were sharing about African Americans, and I'm glad you told me all that stuff, because I didn't know that they put us on the board and we were included. And because the thing about it is we're the ones. And I really feel like we got to go out into the community. Like in Dover, we need to be on Lockerman. We need to set up a little shop out there on the street and give people the shot, because those are the ones we got to get. Them ones that's out there doing drugs and stuff like that, they ain't caring about no shot. If we could be out there and say, hey, we care about you. Like the Black Consortium in Philadelphia, it's awesome what they did, how they went to the Leo Porter Center and they had almost 5,000 people in line. And you saw that line, it was all African Americans. Because me and my wife, we noticed when we got the shot on March 20th, when we went to Bay Health, you could count the number of African Americans and Latinos in the line. It was very few.
Right. But here's the thing about it, Dave. We're not in line because we don't want the shot. We're not in line because we're working 2 and 3 jobs or our Wi-Fi. Who's got time to sit on the internet all day trying to book an appointment? That's not who we are. We are way too busy for that, or we have a different story. So you've got to do the community outreach, which we're all doing. Everybody on this panel, especially Ms. Bernice, Mr. Bill, and you, David, and I, we are working. The governor asked me, how you doing this, Joan? I said, I'm deliberate. I'm intentional.
Exactly.
It matters to me, so absolutely. And are we getting ready to get together? We got an NMA meeting Thursday night where we're going to get together and we're going to take over the Chase Center or in Dover Downs or somewhere, and we're going to get these folks vaccinated, because it matters that when you get vaccinated, there are people that look like us, sound like us, walk like us, talk like us. All of this is important. And we are not in line because we don't want it. We're not in line because we're busy and we're working 2 and 3 flipping jobs trying to make ends meet. That's what's going on. Miss Bernice, did you have something?
Yes, and the other thing too is it can't be an 8 o'clock, 8 to 4:30 or 8 to 5.
That's right.
To be able to, and this is the thing that I always say about community action. We're even willing to do evenings.
That's right.
Weekends. We did it on Sunday. And when we did it on Sunday, we know that there was a lot of the ministers that came. We made they were early enough that they got this shot and they went on to church, because we wanted our ministers to be in those churches and talk to their parishioners about how important it is. And
that's right.
It's going to take all of us wearing the mask. Sometimes I think people, why not wear the mask right now? Because we need the mask. We need to wear them. It's not so much about us. It's about we're trying to make sure that other people doesn't get the virus.
That's right.
We got to, all of us has to be out here, not only talking the talk, but we got to walk this walk. And especially in those communities. And I just listened to Mr. Williams when he was saying, you got to go out. You can't, this is something you can't sit in your office or in your lounge chair and think it's going to happen. It's not going to happen like that. You know, I had a lady who was 103 years old. Now, if you got a 103-year-old lady who wants to come get a shot, come on, young people, what's wrong with you? She wanted to see her grandkids and her great-grandkids. So, you know, it's what you want, and it's what you want.
That's right.
But it's our responsibility to teach, preach, and also do the outreach.
That's right. Good job. So we're going to take the poll one more time, and we're going to see if there has been a change in mindset. So if we could bring the poll up once more. Thank you. If everyone would just take a moment to answer that question. And then Lori, if you could let me know what the response in the beginning and in the end is, I can reveal that to our listening audience. And we want to thank you all for your time. Special thank you to the panelists for your courageous conversation, your honesty, your outreach. We can't do it without you. We are all in this together. I have nothing planned any weekend between now and June because my goal is to vaccinate everybody, and I will go anywhere. And we need to get some major sites going and get these folks vaccinated. All right. We don't have the first poll results at hand. Okay. So maybe we'll have where we are. Do we have the percentage for the finale? We got 33 people on. Yes, 100% said yes. You guys are awesome. Yippee. Thank you to the panel. Every conversation matters. Thank you to the viewers. Thank you for watching. Thank you for listening. Thank you for participating. Like I said, if you can't find a site, call my office. They're going to give you a hard time, blah, blah, blah. Just say, Dr. Coker said I need to get a message to her. Oh, the first one was about 88% said yes. So for the additional 12% of you that have jumped on board, thank you, thank you, thank you. We are now at 100%. Thank you so much. And everybody, have a great evening. Again, thank you to our sponsors. We really, really, really appreciate you sponsoring this conversation. And to United Way, thank you for the invitation for all of us. Read a page, keep doing what you do. We appreciate you, everybody. Thanks, everybody.
Yes.